Hello, this is Dr. Iker Leycegui, and I'm here in Florida, internal medicine. I'm going to give you an update regarding what's going on with the COVID-19. In this video, I'm going to talk about the situation around the world. Everyone is talking about ventilators. I'm going to talk about what's a ventilator, why ventilators are important in more detail. I'm also going to talk about updates in Florida, and then I'm going to talk about medication updates and trials that are going on. So stick around. Now, just an important point is if you speak Spanish, you can put subtitles in Spanish on this video, but you have to do it from a computer. If you do it from a mobile device, it will not work. So, and the same goes if my videos are in Spanish, you can also watch them in English. As long as you're watching them from a computer, you can select closed captioning or subtitles in English. And that way you can follow my video. So I'm going to go with one video in Spanish, another video in English. That way it's less tedious of talking about the same thing and just doing it on different languages. So let's start here. First, starting off, since my last video, we have had a significant increase in cases confirmed. We're up to 713,000, which does make sense based on the exponential growth. If you look at exponential growth models, this was expected. We have had expected growth of around 30%. So yes, we have passed China. That happened around Thursday night. And now we're up to 136,000 cases here in the US. Italy, they have ramped up testing significantly. So they're up to 97,000 cases also because of this increased amount of testing. Passing China, and Spain is very close to China now. Spain, where also the situation has increased significantly. We are seeing not only an increase in deaths, but also an increase in the numbers. Now, what I wanted to talk about also that Italy is one of the best healthcare systems in the world. Many people may not know that, but actually they count with a very, very advanced healthcare system. And it's really eye-opening to see that in a country with such a great healthcare system that they're struggling so much in taking care of critically ill patients. Now, the situation with Korea has been, as you can see here, Korea remains at 9,583. They have had increased cases. However, like I've talked on many other videos, we have to test, and we keep testing because we cannot fight an enemy we cannot see. I understand that we didn't have enough testing available, and that's why we were only being very selective with the testing. But testing is definitely ramping up. More private companies are coming out with their test kits. They're also they have been also developing kits that give you the results sooner than the ones we have currently. Plus, the ones we have currently have to be shipped out of state in most places, and that obviously delays the whole reporting, which sometimes it could take up to 10 days, but it's around 5 to 10 days. Now, looking at Korea, they have instituted this. I want to show you guys this video so you can see what's going on down there. Gonna play it here. They have testing centers when you come in. And in these testing centers, what they're interesting is that they're not only just drive-through centers, but they're also a very safe way to perform the testing. And the testing can be reported on the same day. So that's very, very interesting. Also, they're very careful with who comes into the country with this development of an app where you can scan, and through the app, they can monitor every person that gets tested. So they're definitely using technology. They definitely have the experience from the prior outbreak of MERS that happened a couple years ago, so they were definitely ready. Now, when it comes to the supplies, and what I talked last time about not having the personal protection equipment, we we definitely having still shortages in that regard. It's a very difficult situation because now every single country in the world is suffering from this pandemic, and everyone needs supplies. So we definitely are ramping up production, but it's going to take a while to get there. So the hospital systems have instituted locked up masks. You may you have to return the masks of the end of the shift. They're, I don't know what type of processing they're doing, but they're trying to safely reuse the masks, and hopefully this situation will get better. Also, I did see I watch on YouTube a very interesting interview with a Chinese doctor who has been treating patients since January, and he was actively involved in the development of the hospital they built like in a week or so in China. And he was describing how they get ready to see patients in China. So first off, they have three different areas that they go through, from the gray area, which is where all the doctors are, to the red area where the patients are located. And on through these steps, it usually takes around 20 minutes just to get the personal protective equipment ready to get in. So they have a triple layer of gear from scrubs. Then they put on top of that another layer, and then another layer of protection. Not only they have goggles, but also have the face mask. They have two masks. They have an N95, and as they're coming in through these different sections, they get checked by other colleagues in there. And so when they go into the red area, they know for certain that everything is airtight. And at the same time, when they come out, same thing. They have to go through these three different checkpoints, and that way they have really tackled contamination outside of the hospital setting. So it was a very interesting conversation that I saw in YouTube. So of course we wish we had such a protective gear at this point in time, but we have to go with what we have. The situation is growing exponentially, as I showed you initially, and of course now not only there's a problem with the personal protection equipment, but in Italy, for example, there's also a lack of doctors, nurses, respiratory therapists, and many patients have been flown now to Germany with an air ambulance. So Germany is helping them out. So everyone is talking about the ventilators, and we need ventilators and more ventilators, and most people don't really know what ventilators are. So I wanted to take a time to explain you why ventilators are very important, especially when you have a respiratory infection. So what happens is when you have pneumonia or a respiratory infection where you have significant inflammation in the lungs, you have um, purulent material, you have fluids in the airspace deep in the alveoli, which is like the smallest area of the lungs where the air comes in and goes into the blood. You have oxygen transfer from the air inside the alveoli of the lung to the bloodstream, and then at the same time you get CO2, which is carbon dioxide, coming back out. So this very thin membrane, if it's covered with inflammatory cells, if there's even purulent material or water, in some cases like fluid from, say, a patient has on top of that congestive heart failure or kidney failure, or from fluid overload or so, what ends up happening is you don't have that transfer of oxygen in that membrane. So with a ventilator, what happens is, when are you going to use a ventilator is usually say you're at home, this inflammatory process is happening, you're getting short of breath, and just from, say, walking from here to the kitchen, I would feel like if I had sprinted 100 yards at full speed. That's how you would feel, because you're not getting enough oxygen transfer into your body. So you end up going to the hospital. They put those little prongs that everyone has seen on your nose. So that increases the concentration of how much oxygen you're getting delivered into your lungs. And that can increase the saturation of your blood, and that could make you feel better. But what happens if that's not enough, and you keep going up on what you can get on the little prongs? So what ends up happening is you need now pressure delivered into those lungs, and that's when the ventilators come in. Is we pretty much sedate you. We put a tube, which is an endotracheal tube, down into your trachea through your mouth, and then that tube gets connected into the ventilator, which is the machine. And then the machine, what it does in most of its advanced settings, is it delivers pressure ventilation, which obviously cannot be too much, because if it's too much pressure, it could obviously cause some trauma in your lungs. But also at the end of when you breathe, say when you're exhaling, when the air is coming out, it can also keep some pressure in there, which we call positive end expiratory pressure, which is PEEP pressure. So that also improves the oxygenation in your bloodstream. So patients require a ventilator because of this reason. So while the infection is taken care of, and all these fluids and your oxygen demands are being met by the ventilator, it may take a while for you in order to get that healing in the lungs. And when the time comes where that healing happens in the lungs and there's less fluid in there and this membrane gets better, that's when we decide that it's time to remove that tube and see if you can breathe by yourself, and then we take you off of the ventilator. Now that process could be 1 week, 2 weeks, sometimes 4 weeks. And of course, how long it's going to take you to come out of that ventilator is going to depend on if you have any other medical problems, like I was talking before. If you have congestive heart failure, well, you're going to be less, you're not going to move very efficiently the fluid, because your heart's not working well. Also, if you have a kidney problem, well, the kidneys are like the drainage system of the body, so you're not eliminating fluid well, so the fluid is going to accumulate. Plus, you need to understand also when you're in a critical situation, you may need some fluids, you need antibiotics, you need all these other external compounds coming in there that also cause fluid imbalances, mineral imbalances. So a critical care specialist not only has to deal with the situation that you're not getting enough oxygen in there, but also you need respiratory therapists to be adjusting the ventilator. You need to have the expertise of the pulmonary critical care doctor managing the everything that's going on with the fluids and minerals, and if your infection is getting worse, and the hormones. So it's a very complex situation. So it's not just hooking you up to ventilator. We also need the healthcare system to be there to handle you when you're critically ill. So it's very important that our healthcare workers don't get ill, that they don't that they're not able to come back to work because they get exposed to the virus. So we really, really need to protect everyone, but that's in the intensive care unit. That's why it's my concern that they get personal protective equipment. Now, coming back to what I wanted to show you here regarding the ventilator situation. So these are the numbers I wanted you to see. So these are the number of critical care beds we have per capita. And as you can see, the United States, it's all the way up here. Then Italy is here, and we've seen that Italy is having trouble with critical care beds, with ventilators, And actually, they're number 3. So imagine what can happen in other countries. I want to touch about Mexico too, since I have many family members in Mexico and I'm from Mexico, Mexico City precisely. And as you can see here, also Spain struggling with high mortality rates. Difficult situation, because if you are in a situation where you're going to require a critical care bed and a ventilator, if there's not one, then you're going to die. And unfortunately, that could have been prevented if you had access to a ventilator and a critical care unit. So the mortality rate goes up significantly if you don't have access to a proper critical care unit. So as you can see, these are the top countries. Now, this data is taken from the Society of Critical Care Medicine. And here they have some numbers regarding the ventilators we have in the United States. And you can see here that we have, in a survey that was taken in 2009, there were 62,000 full-featured mechanical ventilators. And at the same time, we have some older models in storage. And they can add another 98,000 ventilators to the United States supply. So it was calculated by some data I saw. I don't remember where I read it, that probably we would require around 700,000 ventilators in the United States if the epidemic really gets bad. So this is why it's so important that we don't all get sick at the same time, so we don't overwhelm the healthcare system. Now, looking at a country like Mexico, this is from El Universal, and this is from the Sector Salud, which is like the socialized sector from Mexico of healthcare, and it's showing they only have 2,000 ventilators. So this would be a grim situation in Mexico. Because of the population they have, especially in a city like Mexico City, and based on the numbers in comparison with other countries, where, as you can see, Italy is having trouble, as well as Spain, in spite of having being on the top 10. Mm-hmm. Then I wanted to talk. Then there was this tweet from the Florida Health Department that I wanted to show you, that I thought it was very clever. And let me play it from the beginning. Here you can see it. It just shows how exponential growth works and why it's so important what we're doing, all the interventions the government has made, and all the interventions we have done ourselves. It feels like we're just at home and nothing is happening out there, but we really, really, really need to hunker down. This is serious stuff. We need to remain very, very consistent with the strategy. Now, one thing that's important in this regard is you need to understand that if you take the time from someone gets in contact with a virus, so it could take maybe 6-10 days until you start experiencing symptoms. It has been calculated that it takes maybe around 2 weeks in order for you to get hospitalized. And then in order to recover, maybe another 2 weeks. So we're talking of maybe 30 days from the time you came in contact with the virus, if you became very ill, to get back to the baseline. So I'm saying it takes a while for you to get in contact with the virus, then exhibiting the symptoms, then having worsening of the symptomatology, and that's when you show up in the hospital. So that's why, even though right now you may not see that there's chaos, or that the numbers are not as high as we thought, or you're not noticing anything and you're in your home and you're like frustrated because you want to come out, this is what you need to understand, that this is exponential growth. So it's crucial that we keep the quarantine in place. Now, so in that regard, nothing is under control. We have to wait, especially in other countries. Like I have some friends in Mexico keep saying, well, everything is under control here, nothing is happening. I hope to God that that's the case. But how is this going to be tackled? Like we have been discussing, I want to see more testing. I want to see contact tracing everywhere. I want to hopefully we get more studies regarding new therapies that are there, and some trials that are ongoing currently, which I wanted to touch as well. So everyone is talking about different medications to treat this. Specifically, I'm going to talk about two. I'm not going to get into the remdesivir or plasma therapy. I'm going to talk more about plaquenil, which is hydroxychloroquine, and azithromicin. So first off, the thing that's very important that you need to understand is that all medications have a risk benefit, and when we don't have enough evidence to support that these two drugs will not cause not only improvement but also harm, we have to be very, very careful, because these two drugs are not drugs that have no side effects at all. Actually, you could have significant cardiac side effects, and many of the patients that suffer from this viral infection have heart disease. So these are my points on the regard to hydroxychloroquine and azithromycin. Number one, for prophylaxis, to prevent the contraction of the virus, definitely, I would never use them for that, because you have just so many side effects. You can get retinopathy in your eyes. You can have low sugar. You can have low potassium or mineral abnormalities. You can also have a very significant cardiac arrhythmia where you could die. So you can have also psychosis, and that in combination with azithromycin, which could also cause some cardiac arrhythmias. So you could have a 1-2 punch there. So you really want to, I would never use it in prophylaxis or for very mild symptoms. Like say you call my office and tell me, hey, I'm having these symptoms, can you send me this? I would never use it for that. Perhaps now you're hospitalized, you're gonna go downhill, and you may require a ventilator. I would say, well, at that point in time, I think you could participate in the ongoing randomized controlled trials and receive the medicines. But at the present point in time, we just don't have enough data, but we do have enough data on these medicines that they could have significant side effects. So those are the things I wanted to touch there. As we get more information regarding the trials, I will let you guys know. So I hope this was useful and helpful. My next video will be in Spanish. Remember to, if you only speak English, to put subtitles in English from a computer. But before I leave, I wanted to just touch on the Florida situation. I was forgetting. So here in Florida, we're up to 4,246 cases. We have had already 56 deaths. You can see the spike here. So that is significant. We still have on the dark blue, the highest concentration of cases in the Miami area, Coral Springs, West Palm Beach, Tampa, and Orlando. And here in Port St. Lucie, we have already 23 cases, and we have had a total of 2 deaths. So while on the demographics, this is interesting. There's actually more women. Usually it's more men if you look at the overall statistics. But I wanted to touch on that. So, and like I said last time, I really wanted to take the time to thank all the nurses, respiratory therapies, LPNs, staff from the hospitals, public workers, transportation, everyone that is up in the front lines of this epidemic, of this pandemic, exposing themselves. You guys, have my prayers, and thank you for everything you've been doing. Here we have some pictures of some friends that have been risking their lives, exposing themselves to help others. So I really, really want to thank everyone in the healthcare field about this whole situation. We're coming together, and if we stick together, we shall defeat this. Also, as an update, I wanted to show this clip here of the drive-through testing, of how it's happening now more and more in more places. So you can see this drive-through location. So very good. So anyhow, so have a great weekend. Thanks for sticking around. If you like this video, please subscribe, like, share to all your friends and family members or anyone that could find some usefulness on it. I'll be around and have a great weekend. Take care. Ciao, ciao.